Healing Hands Health Society presents Dental Webinar Series. We have planned a series dental webinars to keep you abreast of current practice. This series on prosthodontics will be via Zoom, Facebook Live. Presenters are drawn from dental schools in the USA, private practitioners from around the world. To register for future webinars, visit www.hhands.org/dental-training. For future inquiries, contact Facilitator.
Welcome once again to another edition in our dental webinar series. Today we are privileged to have Dr. Sable Muntean, all the way from Edwardsville, Illinois. Dr. Sable is a native of California, but practices at the University City, in University City, Missouri. She graduated from LECOM School of Dental Medicine, Florida, simultaneously earning degrees in Doctor of Dental Medicine and a Master's in Health Services Administration. She then attended the Southern Illinois University, where she completed an advanced education in General Dentistry, followed by an Implant Fellowship. Dr. Muntean has been was also inducted into the Pierre Fauchard Academy in February this year and has published research on implants in Compendium. She'll be presenting new research at the next Academy of Osseointegration meeting and the ITI World Symposium in Singapore. Dr. Muntean also spends her time helping pre-dental students in their journey to dental school through an organization that she co-founded called ignitePreDent. Dr. Sable, it is a privilege to have you on Dental Webinar Series today. Welcome to the series.
Thank you. Very happy to be here and very thankful for this opportunity.
All right, I'm just going to stop sharing my screen and you can, take over and just go ahead.
Okie dokie. Let's see. All right, can everyone see my screen?
Yes, I think so.
Perfect. All right. So today we're going to talk about making a good first impression of dental implants. So let's get started. First of all, as I said, I wanted to thank you, Dr. Uvoh Onoriobe. Hopefully I said that correct, for this opportunity. And I also wanted to give a quick shout out to my dad, Dr. Soren Muntean. He's also a dentist. He helped me with a few things, putting this PowerPoint together. And one of my mentors, Dr. Gadia Peabody, for actually introducing me to you. And also Strawman, the implant rep over here in the area, was very helpful for me for getting a few better pictures and resources for you all. So just a quick disclaimer, I have no financial affiliations with any of the products and companies presented, so feel free to ask me any questions. I have just worked with them, and that's why I'm presenting them. So today, we are going to talk about parts that have to do with dental implant impressions, taking of impressions, analog versus digital, custom impressions, verified impressions, and materials and methods. And I've incorporated some cases as well that I have done, just so you can kind of see things live in action. And I know impressions aren't always the most exciting things, so I want to make it as exciting as I can. So it's super, super important to take a proper impression. This is actually an impression of my teeth. And if you notice, I have 3 premolars, because one of them, the most distal one, is an implant on both sides of the maxillary arch. And it's really important to take those diagnostic impressions, not only for us to understand how to plan our cases, but also when it comes to sending things to the lab for them to integrate with CBCTs so that we can make surgical guides that are accurate, that are going to fit, and that we can, place an implant with, whether it be a fully surgical guide or a pilot guide. It's super, super important because there's so many structures in the mouth, anatomical structures that we need to be aware of when placing these implants. So this one, this thought process and term kind of came a lot from Dr. Peabody. That's where I first heard it from, but the crown down mentality. So basically when you're planning a dental implant, please, please, please make sure that you're thinking about the restoration first. So the way that you're going to place that implant is based off of how that restoration is going to be. So where your occlusal table is going to be, make sure it's in the middle. You know, when you're making that restoration, find at the end, you know, you definitely want your occlusal table down the center. You want your broad, flat contact. Super, super, super important. So again, when you're planning all of this, make sure you're thinking of the end and not just, I need to place this implant and that's it. So parts that are needed when it comes to taking the impression is you have your impression coping, and that is going to look different based on if it's open tray or if it's closed tray. Then you're going to have a scan body if you're taking a digital impression, and we'll go over that. And you need an impression analog. So basically an impression analog is a replica of your dental implant. And that way the lab can use that to put everything together as if they're actually looking in the patient's mouth. One keynote is when you uncover that implant. So basically if, let's say, you were not able to get the stability that you wanted to be able to place a healing abutment over it the same day as surgery, you're going to put that cover screw on there, and then you're going to let it heal for those 4 to 6 months. And then you're going to uncover that implant, and it's not, you know, a major surgery or anything. It's, you know, making that incision and getting access to that implant, taking the cover screw out, putting the healing abutment on. And you want to wait at least 2 weeks after the uncovery to take the impression, because you want that tissue to come back together and heal properly for you to get an accurate impression. So make sure at least that 2 weeks. So here are some things that you're going to need, like I said, but I wanted to show you what they look like. So this on the very left-hand side is the driver. So you'll need a driver in order to screw all of these parts in to the implant. And you have the next picture is the impression copings. So usually for a lot of companies, there's a short one and a long one. So the short one's on the left, obviously. And so usually you'll use that short one in the posterior because the patient has to stay open for a while. And, you know, if you have that long one in, it's a lot harder to do that. And the long one, you'll use more towards the anterior teeth. Definitely, I would say from my experience and my research that open tray impressions are more accurate than closed tray. I always try to do an open tray impression to be able to provide as accurate of one as possible, but doesn't mean that a closed tray is bad or anything like that. There are a lot of cases when that's the better choice. So closed tray impression is the next picture, and you can see that cap that's on there, that big purple cap will actually come off, and then you'll screw it in, and then you'll put that cap back over. And then the picture to the right is a scan body. So again, that scan body is used for digital impressions, and you see that it has that bevel in it, and that bevel is something that the scanner is going to recognize, and that bevel usually you will place that as much as you can on the buccal or facial, and that will give you the reading that you need and that the lab needs during your scan, so that they can print out the model and fabricate your abutment and your crown. This is, I wanted you guys to envision what the lab analog is doing. So on the right-hand side, on that lower right corner, that's the lab analog itself. And again, it's basically just a replica of the implant. So now you're kind of seeing a side by side, and you're seeing how all of that should sit, okay? So let's talk a little bit about materials and methods. So what I've kind of learned is you can treat it like a crown impression, where you're going to put, you know, the medium body in the tray and then a light body over the implant itself. And then you always want to extrude a little bit more onto the occlusal surfaces of the adjacent teeth, because you want to get as much detail as possible. But another way to take an implant impression is one that, again, Dr. Peabody actually taught me, which I think is super cool, is you take, if you see in that corner by Kerr, there's the extrude putty, extra putty. And so you'll take that and you'll have the assistant mix it up. And as that assistant is mixing it up, once it's one solid color, you're going to have them start putting, making it into the shape of a hot dog. And at that point, you'll take, you as the dentist will take your medium body, and with that medium body, you will squirt that around the implant itself, and again, those occlusal surfaces, while the assistant is putting the now hot dog shaped putty into your tray. And once that's done, then you'll put the tray inside the patient's mouth, and you'll have a very, very rigid impression. And you also won't have to deal with, you know, a lot of excess, you know, and patient discomfort, because, you know, that's what the thing, you know, they'll gag on the most and whatnot. And so it makes for a lot more comfortable and cleaner of an impression taking. So again, that's with the use of the putty and a medium body. And it's good to use that medium body because it is rigid and you're not really looking for details when you're taking an implant impression. You're looking more for, of the implant itself, I'm saying, you know, you're looking more for that rigidity, because you want to be able to attach that lab analog onto the impression coping once it's out of the mouth, and not have, you know, while you're doing that, not have that lab analog move on you, because that's when you'll get a crown that won't seat correctly. And another impression material that is very popular for taking implants is ImpreGum. And it is very, very, very rigid and strong. And honestly, in any of these, I would tell you, due to my own experiences, that it's very important for you to block out any undercuts that are in the patient's mouth, particularly if they have a fixed partial denture, because if you get that stuck onto that bridge might be coming out with it. And though, knock on wood, I have not done it myself, I have heard a number of horror stories of, you know, having to cut out that impression to avoid popping off a bridge or anything like that. So please, please, please make sure you're aware of those undercuts. Please double check that the patient doesn't have any bridges in there that you can get the impression material under that would cause a lot more problems. So this is another trick that I've learned. So in order to extrude more material around that impression, or around the implant, you can take your yellow tip, as you can see, and just cut it, and about 1/3 of the way up. And that is going to allow for a wider platform for that material to come out. So you can squirt out the material a lot easier and get that accurate impression of that implant. So there's kind of two ways to do this one. You could take a very sharp 25 blade and cut that 1/3 in that area and take care of it. Or you can take a scissor, and then also afterwards with the scissor, if you want to make that, you know, widen that tip some more, you can kind of, if you can imagine, stick that scissor in the tip and kind of break it open a little bit and get more material out that way. Because it's, as you can know, that yellow tip is constricted at the end. And so this is just going to allow for your life to be easier. And I'm sure we all want that. So here is a little video by Strawman for open tray impression coping technique. So it pretty much is the same for all of your impressions, all of your systems, but you can see again on that lower, you have the longer impression coping and the short impression coping. So he or she grabbed the longer one. And so in the Straumann situation, there's a rectangular platform that you want to line up. That's why it was moved a little bit there. And you're going to hand tighten that a little bit, but you're going to take your driver and put that in to make sure it's nice and tight. And always, I know that there's a lot of companies that say, oh, don't worry about taking an x-ray because, you know, certain things are going to fit certain ways. And there's only one way it could fit. But I don't know, I just, for peace of mind, I always say to take an x-ray, and I'll go into that a little bit more. But the key, and let me show you the closed tray as well. But the key really is to make sure that you hand tighten it. Do not torque anything. The only thing that you're ever going to torque is that final screw in your abutment. That's going, your next step will be to place the crown over. So don't do that, please. But so this is your closed tray. So you're gonna screw that in, and then you're going to put the little cap on and proceed with taking your impression. So I'll just snap that on. There you go. And all is good. Okay, so I learned in my fellowship the key to taking vertical bite wings. I know a lot of people take PAs, but the problem is that can occur with a PA is that you might not always get the angle that is going to show you that that impression coping hasn't completely seated. So vertical bite wings are really the best way to go. And you can take that for the impression coping seating, for a custom abutment seating, and then or standard abutment as well. But we learned to do custom abutments on everything, or we also had UCLA abutments. And then you can also use that to check for cement removal, because you'll get the most dead on x-ray that you can in the situation. So here you can see an implant crown that was delivered, and there's that vertical bite wing, and everything looks nice and clean, no cement. Looks like that screw was completely seated for the abutment. So, you know, success for everybody. And these are just some examples of good and bad. So obviously on the left is one where that impression coping is not seated all the way, and that's because of that space that's in there. So definitely if you see a little bit of space, that's not a good thing. If you don't see that the screw is completely seated down inside of that implant, that's another sign that you did not successfully seat the impression coping. And again, that's when you're going to have problems and with what the lab is going to deliver to you. And on the right-hand side, you'll see one that is completely seated. It's nice and flush with everything, and that's actually a BLX implant by Straumann, and I'll show you guys an example of that a little bit later with one of my own cases. So let's talk a little bit about digital impressions, because that's the way that everything's going nowadays. So you can use a trio scan. That's actually my mouth. And this is when we were having fun one day in clinic, and I have quite the arch. There are many different scanners out there, and you can use these scanners not only for your initial diagnostic impressions, but you can also take them for the implant impressions, and I will demonstrate how. So you need that scan body, which I showed y'all earlier. And when you're going over, so basically the first step that you want to do is scan everything before you've even started the surgery. So you'll scan that patient's entire mouth. And then what happens is in the area where you place the implant, you're going to trim that area. That's the term that's used on the software, usually cut or trim. And so you kind of make that area disappear, because now after you've done the surgery and you put the scan body in, you want to capture, you know, what that tissue looks like. And so you'll put in that scan body, again, orient those bevels towards the facial or buccal. and you'll make sure that's completely seated, and then you'll take the scan, and that's what you're going to send to the lab. And then you'll take that scan body out and you'll put in whatever healing abutment you're going to be choosing. And this is also a good way of getting, if you would like a custom healing abutment made by the lab. So this doesn't necessarily have to be at the point of taking so it could be at the point of after you've finished the surgery, so you can get a custom healing abutment in, or it could be at the point of taking that final impression for the crown. So this was a patient that we had at the clinic, 66-year-old female, and she presented with class 3 mobility and quite a foul odor on number 30. And you can see very clearly where that was all coming from. Perio depths around the tooth were between 6 to 11. And she had a fracture in between the roots. And we actually did the surgery, first surgery for the year 2020. So super exciting for me, maybe not for her. But she did call me afterwards and say she didn't have any pain whatsoever. So I was like, oh, okay, good, success. So we extracted the tooth and we did extraction immediate placement of an implant, which you will see. So that was after the extraction. That's what came out. So really wasn't that difficult of an extraction. But then we placed a Southern Promax implant, and you can see how that is oriented in the mouth. And after that, so remember, I had already scanned her and everything beforehand. And then I trimmed that area in the digital scan, and then I put the digital scan body on. And you can see again that bevel is towards the buccal. And then I rescanned that particular area. Okay. And so then the Trio scanner was happy, and I took that scan body back off, and then I put a peak healing abutment in there, and I sent it off to the lab. And a week later, they came back, they sent us back a custom provisional, and I put that one in there, and she stayed with that for a couple of months. Unfortunately, it was more than just a couple of months due to COVID. But it was also part of a study that Southern has. And so that was the protocol that we followed. So you can see this was after the implant was placed, and that area did fill in on the distal of the implant. So no worries over there, but it's a 8x9 millimeter implant, so quite the big boy. And we got quite the torque on it. So the big thing with these implants are getting even 100 Newton centimeters torque. So they're made especially for extraction immediate placement. So in this situation, it worked out quite well for her. So now let's go into custom impressions of custom healing abutments. So this is actually what my research is on. So I hope you enjoy. I just had to put this in. It's just one of my favorite comics, and dude, what are you doing? I got a date tonight and I need to make a good first impression. So hopefully y'all are laughing. But again, it's super, super important to make those good first impressions, because we want to be able to give them to the lab and make sure that we don't have any areas where we could, mess up anything that's not going to allow us to properly place that implant or deliver a final prosthetic or whatever it may be. And this is super important, not only for single implants, but also, when we're doing those full arch cases, very, very key. So this was for my patient who, number 12, he already had missing, and we decided to put a Straumann BLX implant. It was a 4.1 by 12 millimeter implant. And so by taking that accurate impression ahead of time, we were able to send that to the lab, and you can see how it looks. They took the CBCT, they integrated it. with the impression, and then they were able to, from that, not only fabricate the guide, but also fabricate the provisional that we used to send the patient off with, because the patient always told me, he's like, I don't know, my wife like refuses to look at me from the left side because I have that space in there. So I always have to sit so my wife sees me towards the right and my smile looks full. So this was our initial presentation. As you can see, there's not much interocclusal space, and so I actually placed the implant about 2 millimeters subcrestal in order to gain some more of that interocclusal space so that we can get a nice emergence profile and that we can get enough retention when it comes to the final crown. So this is what that looked like. Again, so this was digitally done, and so you can see that digital 3D printed model, and saves a lot of time for you as well with, you know, not having to pour up the impressions in between patients and whatnot, and you know, gives your assistant more of a chance to hang out with you. So we had a little stent made as well over that, so we can, you know, make sure that we align everything as best as possible. Though most of my surgeries in my fellowship we did with a pilot guide. This one we did do surgically with the full surgical guide, so we can, you know, fit everything as perfectly as we could. And you can see again those nice broad flat contacts. You see where exactly you want that implant to be placed because you're thinking of that crown down mentality. This is what the provisional looked like. Very, very, very important for you to have the proper contours so that that tissue is going to heal and you're going to create a nice emergence profile. And so you can see what that looks like in that picture. And then, you know, make sure that you have, especially, you know, with an anterior tooth in particular, you know, make sure you have that patient come back at least, I would say, once a month. So you can check on how their tissue is healing, see if you need to change the contour of your provisional, whether additive or reductive, so that you can get that emergence profile that you want, because it's very easy for you to control if you're keeping an eye on it. But if you go a little too late, you might not be able to have the tissue heal the way that you want it to. This is after the implant placement, so you can see this is just the slices through it and the CBCT, but you can see we had a lot of buccal bone left over, so that was great. You know, that's your goal when it comes to placing these. And you can see that that's perfectly straight down the middle. Proud moment. Because actually, so we did use that surgical guide as much as we could, but then we did end up having to kind of modify a little bit and do it a little bit freehand, which is another reason why I just can't stress enough when it comes to placing implants, make sure that you have the proper training. It is very, very important. Implant cases, a lot of people think, you know, oh, okay, they're straightforward, they're easy, you know, what can go wrong? You know, if I have enough bone and enough ridge, yeah, the likelihood if you do have those things is a lot less, but that's a reason as a GP why I did the implant fellowship, because I wanted to know when things do go wrong, you know, what am I supposed to do and how am I supposed to approach the situation? And so by doing a lot of these freehand, so to speak, you know, even, you know, with the pilot guide, but still I was able to learn how to feel that bone. And through a surgical guide, you don't have that possibility of really feeling, you know, the density of the bone and where you're going and whatnot. And those surgical guides aren't foolproof. And so you need to know what to do when things don't go your way. And so that's, you know, a situation that happened here. And we did have to modify the provisional a little bit, but it still worked out great, which you'll see on the next slide. So this was with that provisional delivered. And then, you know, clean that off, and I adjusted the occlusion a little bit more after that, because you definitely do not want the patient biting on that in any which way whatsoever. And you always want to tell the patient that this provisional is going to be a little bit shorter than the rest of your teeth, because we don't want you biting on it, and, you know, make sure that you avoid chewing in that area at all costs. And then also that it's going to be more buccal or facial than the rest of your teeth. Again, it's just so you're avoiding anything possible, and you're getting that of a mastication, and you're getting that proper contour that you're going to want. So you can see now an occlusion. And once this is not the same case. This is another case that was done because due to COVID, I didn't get a chance to finish the case that you just saw. But once you've spent those months making that tissue as perfect as possible, now you have to relay that to the lab, right? And so how are you going to do that? So here are some steps, and feel free to take a screenshot or anything if you'd like, but some steps to take an impression of a custom healing abutment. So the first thing that you're going to do is make sure that you prepare that tray for you to take that open impression, if that's what you'll be taking. But again, like I said, I prefer to take that open tray impression instead of the closed tray. So I like to prepare that before I even take the custom or standard healing abutment off, because you can still see through if you're doing a stock tray or even your custom tray. And you want to line up where that implant is, and then make a hole big enough for that impression coping to come through so that you can gain access to the screw. Okay, so drill that hole that corresponds with the location of the implant into the impression tray, and then make sure you paint on your adhesive onto the tray. And while that's drying, you can move forward with the rest. So you're going to remove that custom healing abutment and make sure you place a standard healing abutment to avoid tissue displacement. Okay, tissue moves very, very quickly and will close that area. And so you want to put in that standard healing abutment in there. It's not going to change your contours tremendously or anything of the custom healing abutment. But it's just something to make sure that tissue doesn't collapse. Then you're going to attach the analog to the custom healing abutment. So now it's like you have your whole, implant and tooth in place. And you're going to take a putty. In this case, we used Siltec. And once you're going to, start mixing that up. And once uniform in color, you're going to place your contraption of the healing abutment with the analog in the putty with the analog down first, and you're going to mold that putty up to about 1/3 the way of the healing abutment. So you can see that from the side profile over there. Okay, and so that's going to allow you to start getting that contour of what the tissue looks like, so that you can make your custom impression coping. Very, very important, mark the buccal or the facial of that tooth, because once you take that healing abutment out, everything's gonna look the same to you. So you're not gonna know which way to orient your custom impression coping. So please, please, please do not forget to mark that area and be aware of it. While it sets, because it takes just a couple of minutes for that putty to set, you can air abrade the impression coping, and that will allow the composite material that you're about to use to stick on better onto the impression coping. Or you can do this beforehand, like before the patient even comes, not a problem. But just if you want to buy yourself some time or whatever it may be. And it also depends, of course, on the setup of your office. But once that putty is set, you're going to unscrew the custom healing abutment and attach the impression coping to the lab analog that is in the putty. Okay, so hopefully you're able to envision this. And then you may remove that standard healing abutment that you had left in the mouth and replace it back with the custom one while you're finishing up the second part of making this custom impression coping. So for the second part, what you're going to do is you're going to place, now you have that little hole, right? And you have the impression coping coming out of it, and you have your tissue mold. So how are we going to capture that? So what you're going to do is you're going to take a little layer of flowable composite and squirt it around the impression coping and light cure. So when I was doing this for the first time, this was actually the case that you're seeing over here on the side of the screen, I put too much composite in there, and I, cured away, and I thought everything was good. And then I went to take out that impression coping, and everything was wet. So, make sure you don't do that. So by doing it in layers, you're going to ensure that that's not going to happen to you. So make sure you keep doing that until you've created enough of the tissue, recreated enough of the tissue, and then remove that custom or standard healing abutment from the mouth, whichever you had left in there. And you'll place that custom impression coping into the mouth and make any interproximal adjustments as needed. And verify that seating with the vertical bite wing, and then take the impression as you normally would. And again, hand tighten everything. You do not want to do anything that's going to be torqued. Okay. So verified impressions, just quickly, a little bit of information. You're going to do verified impressions, particularly when you have a full arch case. That's when they become super, super important. So when you've taken your initial impression and everything, the lab, or technically you can fabricate yourself as well, using Duralay is kind of what they use the most of, but you'll have, you'll put the resin over there, and you're going to have to lute those together in order to verify that you have the proper path of insertion. So this is a case from the Journal of Prosthetic Dentistry. This is not my case, but you definitely want to number all of these bits and pieces, and then you'll lute them together to make everything nice and happy. So I guess they numbered it by tooth number. I tend to number it by 1, 2, 3, 4, 5. So here it's all luted together, and then here they took that impression, and so you can see how everything goes over. So it's a lot for the patient to stay open and whatnot, but all for a good cause. So the last thing that I wanted to present is a case that I did using Chrome, which is a full arch guided stability platform of being able to do like a all on X, okay? So my patient presented to the clinic for the maxilla. She's a 71-year-old female, and this is by far the best chief complaint that or concern that I've ever gotten. And I don't know if I know I have many more years of my career, but I don't know if anyone's going to top this one. But I want to be able to chew a pork chop, because now I can only chew a filet mignon. So tough times. This surgery was completed on February 12th, 2020. So everything that you're going to see is in the temporary hybrid stage. And actually right now she's going through the process of getting the final prosthesis. But again, because my fellowship was only a year and COVID happened, I was not able to be a part of any of that. But you can see how she initially presented to me. Was not interested on anything in the lower, so we ended up doing a partial on the lower, and having to extract. All she had in the posterior was number 31 left, and that would have was a root canal treated tooth that would have needed a retreatment, and she opted to not do that, and she just had an extraction, and we did a partial with the 2 distal extensions. So you can see the final product on the end of how the implants were placed and everything. This was the day of surgery. This was our setup. And I'm not going to go too much into Chrome and the system, but I'm more than happy to answer questions afterwards if anyone's more excited by this. But it was definitely a system that I really, really enjoyed. It's a stackable guide system, and I really look forward to the next time that I get to place with them. So, or using Chrome. So as you can see in that, hopefully my mouse will show it over here in the lower left corner. This is something, it's a rapid appliance that we used to pick up the implants, and that is going to be used as our verification jig. So this is just another way of you seeing how everything comes together digitally, how important it is to take those accurate initial impressions so that you can make this guide properly and have success the day of surgery. And then now you can, again, digitally use to make a verified impression. So now you won't have to do that later on when it comes time to making the final prosthesis. This was just a little video of the day of. I'm a bit OCD, but what dentist isn't? And so I had everything laid out, flashcards, note cards everywhere, all the steps just to make sure. So this was the after the surgery when everyone left. Me and my glory. So here our buccal flap was laid, and you can see she has a number of root tips in there, and then the remaining teeth that we needed to extract. But again, first things first is to lay that buccal flap as much as humanly possible so you can get all those stackable guides in place. So the pin guide was put in place, and it's that, you can see there's a layer of that silver up there. We had some of those long skinny pins that went through to hold that in place. And this was placed so that, we knew that it went perfectly over the teeth, and we knew where we're going to, how much bone we're going to cut down. And, once we take those teeth out, to make sure we have the proper measurements and everything like that. So now we have that. Now you can see that fixation base, and the which is also used for the bone reduction guide. And so now we were able to take out the teeth, and then we, took our lawnmower, so to speak, and made all of that nice and smooth and brought it down so we had enough bone reduction so that we can properly place that hybrid and not have issues with the lip line and all of that. So now we have our osteotomy guide in place, and this is where you're going to be placing those implants through. So now the implants were all placed. There were 6 implants in total, and we have the prosthetic carrier and the abutment positioner in place. And so now we put those multi-unit abutments in there, and they're all screwed in. And we put the this is something that I don't recall the name of the company, but they very wisely made these little leaflets, and then these block out gaskets, which you'll see in the next slide, so that you don't get any material into those multi-unit abutments. And now we're ready for pickup. So we're going to pick up the rapid appliance, which is that one that we're going to use as a verification jig, and then we're going to pick up our temporary hybrid. So here I was picking up the temporary hybrid because that rapid appliance was in all white. But you can see those block out gaskets now very smartly made. Of course, you can use, the end of a Q-tip or whatever it may be, but I really like these ones myself. So then, everything's being held in place. We've checked the midline before we even started. We had, marked, taken measurements for our VDO again, and marked where that midline was, just to triple check that everything was going to be okay and look normal when we picked it up. And so here everything's being held in place, and then the material is the pickup material is placed in there, and we used Stellar by Taub, which is also quite amazing, if I may say so myself. So this is just another view of that. Then while everything was being trimmed down, because now you have a lot of excess material, you want that to be all smooth, from the pickup, we put this is just a tip for you guys to put the, those impression copings. You can put those over for the closed tray, and then you can suture over that. And it just kind of keeps everything nice and clean and orderly, so you can proceed accordingly. And then you'll have access to everything, so you can deliver the temporary prosthesis in this situation. So here it's delivered. Here it is in occlusion, and you can see that tooth that we still wanted to take out later. She was too tired for us to take it out that day, so we just left it in. Here she was just smiling a little bit, but you can see she's a bit droopy. So this was 1 week after delivery. And then after 2 weeks, that's when I took out the number 31 and then delivered that partial. And here's her before and after. So thank you so much for taking the time to listen to me today. I finished on time, so if you guys have any questions, I'm more than happy to answer them. And if you want to ask me anything separately, there's my email address, sableamunteandmd@gmail.com. More than happy to help anyone out. And I really appreciate, again, the opportunity to present to you all today. And I look forward to hearing the next one.
Okay, do you have any question for Dr. Muntean? Dr. Muntean, you are originally from where?
So my family is from Romania, and both my parents, and I was the first generation here. I'm from California. Like I said, went to dental school in Florida, and then now I'm over here in Illinois/Missouri.
I mean, I'm just going to go through that. I know I saw something on your bio, and I see that you've been doing some work in terms of getting people ready for dental school. I mean, I wish I had that when I was trying to get into school. What exactly do you do?
So actually, because I wish I had that too, that's why I started this. So I started it with my mentor, Dr. David Rice, he started a program called igniteDDS, which is a platform that provides resources for dental students and new dentists. And whether it be CE courses or mentorship or, I mean, just a myriad of things. And I had met him my first year of dental school at a business symposium that I showed up to on an early Saturday morning after a 3-4 hour drive. And I heard him speak and I said, could you mentor me? And that's how that all started. And we kind of talked about my journey to getting into dental school. And we came up with this idea of starting ignitePreDent. So I have been very fortunate to go around the country and give lectures at a myriad of schools such as, Boston University, UCLA, a bunch of schools in Florida, Oklahoma, here in Illinois, and the Ohio State, my bad, university, and been able to reach out to a lot of pre-dental students to help them on their journeys and help them with their mock interview or with interviews, help them with their personal statements. Just the other day, I gave a webinar on choosing the right dental school. So that's where that all stemmed from, and that's what I'm doing there.
All right. The reason I bring this up is that I know most people on the call, everybody has a different, I don't know where your journey, your dental journey is going to take you to, but sometime at some point you probably need some help in getting yourself ready for some of people on this call are going to be in the US very soon, or you're going to be in some country. I mean, that is just the fact. Some people are going to migrate and study dentistry around the world. And thankfully we have some resources. And we have Dr. Muntean, who is who works with an organization that can help you because you need the information. I'm just going to share. I'm going to share this for a little bit. I don't know. I think it's necessary for you. If you want to go on there and take a look at it, right? Is this the website?
Yes, that's our igniteDDS website.
Guys, I want you to know if you are interested in studying dentistry in the United States, go to igniteDDS and just look around and make contact with someone because you need some help. You need some help in getting yourself ready. We all thought we are all going to be dentists and we have, similar training, but just communication, how you present yourself, how your demeanor, how to stand with confidence. This has nothing to do with dental training. This is just how to present yourself, how to make your resume look, what kind of fonts to use, because I think some fonts can it boils down to just the way you present yourself. And there are folks who are committed to doing that. If you want to reach out to them, please go to that website, igniteDDS. I'm sure you're going to get some help. Thank you, Dr. Muntean. It's been, how do you say Очень приятно in Romania? Nice meeting you.
Nice meeting you. Mi-a părut bine să te cunosc.
Okay, ignitePreDent,
Nailed it.
I love languages. I'm going to catch that very soon. But nice meeting you. I have a lot of friends from Romania and, very close to my heart. Thank you so much, Dr. Muntean. It's been a pleasure having you on Dental Webinar Series.
My pleasure. Thank you so much.
Healing Hands Health Society presents Dental Webinar Series. We have planned a series dental webinars to keep you abreast of current practice. This series on prosthodontics will be via Zoom, Facebook Live. Presenters are drawn from dental schools in the USA, private practitioners from around the world. To register for future webinars, visit www.hhands.org/dental-training. For future inquiries, contact Facilitator